And good evening, everyone, and welcome to this episode of the worldwide broadcast of Ask Dr. MJ. Why? Because your health is important. We're here to answer your healthcare questions and provide you with infotainment, medical information that you are encouraged to share in your friend group, in your families, everybody, and every opportunity that you gather with people. We want you to be the medical ambassador, the medical ready reference, the person that gets good information out to everyone and shares it. So our objective is not to hide this information. Our objective is to share it. And we want to make sure that everybody feels like they're getting good value by participating in this broadcast. So tonight's episode is going to be absolutely incredible. We're going to start off, of course, with a medical topic. And this is October. October is the time that is most recommended by the CDC to obtain your influenza vaccination, your flu shot. But there are also other shots that are being recommended, the COVID vaccine shot, as well as the RSV vaccine. So everybody recommends that everyone 6 months old and older. So basically, children 6 months old, newborns, up to as long as you live, you should get an annual flu shot. This year's flu shot is a very good match for the variants that are out there. The flu, I've had multiple cases of the flu, a couple requiring hospitalizations and emergency room visits. So it's very important. Everybody's aware of the COVID and things that happens with it. The COVID variants are relatively mild at this point. One, because everybody has natural immunity. They've had COVID more than once in a lot of cases, and they've had the vaccine. So you have a lot of good immunity. Doesn't mean that you aren't going to get COVID. Just means that if you do, it's probably going to be a mild case, and you'll confuse it with just a regular cold or even a sinus infection. That's what everybody comes to me and says, I think I have a sinus infection. And I say, have you tested yourself for COVID? Also, the free COVID tests are now available once again. Just Google free COVID test, and you can get 4 per person of everyone that's in your house. So everybody can order their own. One person can't order for everybody. Everybody has to order, and they have to have, I think, different email addresses. But you can get 4. I just received mine. It took about a week to get them. So I have 4 for me. And I sent the link to everyone in my family, a lot of my patients as well. So I hope that you're taking advantage of it to get your free COVID test. That way, if you get a respiratory tract infection and the question is COVID or not COVID, 1, it is COVID until proven otherwise. 2, if it is COVID, you'll know that you need to take some action, isolate yourself, and also get the standard COVID therapy. The treatment needs to be started within 48, no later than 72 hours of onset of symptoms. If you wait and you don't diagnose it until later, the medicine is not going to do you much good. So it's very important that you start it in a reasonable period of time. So it's time now to get the flu shot. It takes about 2 weeks before the immunity kicks in, and you get it now. It should last you through the rest of the winter, and you will get optimal protection for that. After the end of October, you're starting to push the envelope as far as how late it will be, but anytime you get it will be better than not getting it. So Dr. Collier highly recommends the flu vaccine. I tell everyone the flu vaccine does not give you the flu. The old flu vaccine from years and years ago used to do just that. It was what was called an attenuated virus, which means they would weaken the virus, inject it into you, hope that you got immunity to it, and that you did not get so sick from getting the vaccine. Well, a lot of people got sick, including me. So I didn't want to take it either. But once they changed the vaccine, and the vaccine has been changed now, it's not a disease-giving vaccine. So it just gives you immunity without giving you disease. And so all of the horror stories that you hear about, I got the flu and it made me sick. I got the flu shot and I almost died. All those things, that just is not a reality at this point. So you should not be shy about getting the flu shot. Now, when you go to get the flu shot, they're going to offer you the new COVID vaccine, which is targeting variants that were around a year ago when they developed that vaccine. So even the CDC is recommending that you wait 6 months till they come up with a new vaccine to get that vaccine. So if you have already had at least 2 COVID shots, some of us have had 4 to 7. But if you've had at least 2 and you've had the disease state, you had COVID, you tested positive for it, then you are probably optimally immune and won't benefit from getting the new shot or the shot that's available right now, unless something dramatically changes. Now, when they come up with another one that's targeting more recent variants, then Dr. Collier would recommend that you probably get that one. But right now, I'm just not recommending that you do. And again, that's consistent with the CDC recommendations. They're saying that you should wait 6 months. But again, if you met that criteria, if you had the vaccine, if you're vaccine naive, you have not had ever any of the COVID vaccines, then yes, get it. But they're going to try to give you the COVID vaccine and the flu shot at the same time. Now, the reason for that, the logic for that is that they have you there in the pharmacy and you might not come back to get the other shot if you get one or the other right now. So the pecking order, get the flu shot first. The flu is what's most important and what's out there right now. The COVID is out there, but it's a milder variant. It's not making people as sick. And so it's not an issue at this point. So Dr. Collier's recommendations, get one shot, wait 2 weeks to give that shot to provide optimal immune response, then get the second shot 2 weeks later. But if you know in your heart of hearts, I'm a busy person, I'm not sure whether I'm going to be able to go back and get the shot, then get the second shot. But understand that getting the 2 shots will mute the immune response because you're doing 2 things at one time. If you're doing 2 things at one time, you cannot do both of them well. You might do them well enough, but you can't do both of them well or even optimal. And Dr. Collier preaches optimization of everything that I do, including your medical therapies. So you want to have optimal response to do that. And if you are medically savvy enough to decide you want to get the vaccine, then you probably would feel medically savvy enough to want to go back and get the second one 2 weeks later or anytime after that 2 weeks. So understand that those are the variants that you want to do, and that's how you can do it. That is what we recommend. That is the best way to do it, in my medical opinion, to get one, then get the other, so you get optimal immune response when you're getting the vaccine. Now, the new player in the game is RSV vaccine. So the RSV, they recommend that for adults 75 and older, and for people 60 or older who have multiple risk factors, they have illnesses, they're in nursing homes, they have chronic medical conditions. I would say the nexus for getting RSV is a young grandchild. So if you are taking care of your grandchildren, if you're the one that's responsible for picking them up and taking them to school, and these kids are under 10 years old, particularly out there like 4 to 6, then you probably would benefit from getting the RSV vaccine. If you're not in that area where you're getting that kind of exposure, then you probably don't have to worry about the RSV as an option. But if you want to get it, it's available right now. That's one of the ones you can get as well. But again, I don't recommend getting them all at the same time. I do recommend them a 2-week window. That way too, let's say you get 2 shots and you have some side effect. You have a reaction. Now, you don't know whether you had a reaction to vaccine A or vaccine B or the combination of the two. So that's the other thing. If you isolate the vaccine doses, you get one and you have a problem or a reaction or a negative response of some sort, you will know exactly why you had it, what you got it from, and not to do that again. Because the first time you have an allergic reaction to something, that reaction will not be bad because your body has to create an immune response. So it is the second exposure to whatever it is that you're allergic to that you have severe allergic reactions, or even what's called anaphylaxis, which is a life-threatening circumstance. So those are the times that you will know, and it's good information to know. And that's one of the other reasons that Dr. Collier recommends that. Lastly, always remember Dr. Collier recommends that you take a non-sedating antihistamine, Claritin, Zyrtec, Zylol, or Allegra, and an anti-inflammatory such as Motrin, Advil, or Aleve. Start taking it the day before you get the shot. Take it the day you get the shot, and take it again the day after you get the shot. And that will minimize your chance of fever, chills, a sore arm. All of those are little side effects that are bothersome, that aren't really bad, but just don't make you feel good. You do those things, you inhibit that, and it won't negatively impact your body's immune response. So a non-sedating antihistamine and an anti-inflammatory. Okay, let's do it, Heidi. Let's do a roll call. This is the People Show. It's time to get going. Ann Wells, hi, Ann. Thank you so much for tuning in. You're on YouTube, and we are so glad to have you. Cindy Hill, hey, from Fort Worth, Texas. Hi, Cindy. We appreciate you tuning in. You're on YouTube as well. Thank you. Remember, don't just go onto YouTube. Find and subscribe. Subscribe to my YouTube channel. Glenda Everett, good evening from Warner Robins. Hi, Glenda. So glad to have you back. You're a regular from Warner Robins now. Rhonda Holiness Young from Tyler, Texas. Hi, Rhonda. We appreciate you as well. I hear it's finally cooling down in Texas. Bethany Surge. Good evening, Dr. Collier. Watching from Monroe. That's Big D. There you go. I got it now. Patrick. Good evening, family. One love. One love. Patrick. All right. Regina Miller from Columbus, Ohio. Hi, Regina, Midwest. Thank you so much for tuning in as well. Linda Bloomer from Birmingham, Bright Light City, Black Mayor, Morehouse Man. We appreciate it. Carolyn Brown from Michigan. Hi, Carolyn. Thank you so much for tuning in as well. Sean Big Time Green, my man from Monroe, LA, the first male participant in this broadcast. Erica Chiba, good evening, everyone. Thank you, Erica. We appreciate you tuning in. Zeophius Mills, that's the greatest name of all time. Kansas City, Missouri, the only real Kansas City. I got a friend from Kansas City. I always ask, Kansas City, Kansas? Kansas City, Missouri. He says Kansas City, Missouri is the only Kansas City. Miss Makiba Boland, good evening, madam. How are you? So glad to see you as well. Cherry Woodstock from Fort Lauderdale, Florida. Cherie, we want to make sure you're safe down there in Fort Lauderdale. Get out of Fort Lauderdale. Come hang up with us in Atlanta. You can go back in a few days. Jackie May from Birmingham. Thank you, Jackie. All right. Kevia Green from Denham Springs, LA. Thank you so much, Kevia. We're glad to see you. Siobhan LeConte. Okay, from Covington, Georgia. Hi, how you doing? Charlotte Lewis Lacefield. Good evening. Thank you so much. Oh, that's a great picture with you in the airplane. Country Swag. Kenneth Bobo from downtown Atlanta, Georgia. Kenneth, you right at home. Homeboy. Thank you so much. Cheryl Simons from Montgomery, Alabama, or Simmons. All right, Cheryl. Thank you so much. Lauren Brown, good evening from Raleigh, North Carolina. Hi, Lauren. Thank you so much. Earl Thomas checking in from Miramar. Hi, Earl, my man. We appreciate you. I really enjoyed coming to Miramar. Looking forward to my next trip down there. Invite me back. Rachel Arnold Johnson. Hello, King. All right. We appreciate that. I'll take it. Chili Will from Stockbridge, Georgia. Chili Will. Great new picture you got up there, my friend. Okay. So listen, thank you so much, Holly. We appreciate you. I want to let everybody know, if you go to the website right now, there's so many Halloween themed deals that you get. There are flip cards that get you a variety of different discounts. Buy one, get one free, 50% off, all kinds of things. When you log in, it's a random thing. You'll get some great deal when you go to the website. And look at this. Heilig has done such a great job in getting this website with the Halloween theme. I absolutely love it. More importantly, what I want to say is this. You have time. The holiday season is coming up. What you definitely don't want to do is put on weight. And today must have been weight gain day, because everybody in my practice that I saw today had gained this. And most people were 2 to 5 pounds. But I had one person gain 9 pounds in the last 3 months. And I told him, I said, that one, everybody, that's the wrong direction. 2, you don't want to gain the weight. But 9 pounds is a bit much. And so he told me that he had been traveling. I said, you must have been on a cruise, because that's the only way you can gain 9 pounds. So everybody whose end of year vacations resulting in weight gain, you don't want to continue that trend. This is your opportunity to get that weight off, particularly with the Lipo Drops Maximum Strength Formula. I'm really finding that patients are having amazing success with the combination of the Lipo Drops, using 1 drop of full under the tongue before each meal, so 3 times per day, and the Lipo Nights. The Lipo Nights has been a breakthrough product. You take 2 capsules at night before you go to bed. It burns fat literally while you sleep. It's got multiple components in it that are fat tolerant. They really burn fat quite well. They're lipolytic. They burn fat and break fat down. But more importantly, because it has the melatonin in it, you get a great good night of healthy restorative sleep. That means that you don't have the cortisol stress hormone, because you're in deep sleep. You're dreaming, you're enjoying, you wake up feeling refreshed. But because of that, cortisol is the bad hormone that makes you create fat and puts it particularly in the abdomen. So when you see a person that has the pear shape, that's where they get they may be skinny arms and legs, but they got a big stomach. That's the cortisol hormone that's wreaking havoc to their body and habitus. And oftentimes these individuals don't eat a lot. The problem is that they're too stressed. So when you're stressed and you're not getting good restorative sleep that allows you to go into the REM sleep stage, which is where you get the good sleep, the cortisol hormone isn't there, and you rest and you don't get that fat deposition. But when you have less sleep, you don't sleep well, you don't wake up refreshed, then that's a problem. The cortisol hormone, and you'll notice that the abdomen starts to expand. You're putting on, small amounts of weight. It may be 5 pounds a year, which it doesn't sound, that's only 5 pounds, Dr. Collier. Yeah, but in 5 years, it's 25 pounds. and that time comes and goes very rapidly. So we can defeat that right now. That combination of the Lipo Drops Maximum Strength Formula as well as the Lipo Nights. But remember also, now, again, we talked about the flu season and the respiratory tract disease season. When you go to the urgent care or you come to the doctor's office, they're going to check you for the flu. They're going to check you for RSV. They're going to check you for COVID. Those three respiratory pathogens are prevalent, and there are tests designed to determine which one it is because the treatment regimens are different for each one. And so there's some commonality, like if you have congestion, you're going to take a decongestant. You have cough, you're going to take a cough syrup. But the flu infection requires a special antiviral that's specific for the flu. The COVID requires the specific antiviral that's specific for COVID, and both of those have to be started within 48 to 72 hours of onset of symptoms to have any impact on your disease state. So there we go. Okay, let's start rolling with the questions. Winnie King, taking vitamin D better than taking D3 and K2. Well, one, I recommend vitamin D comes in two types. D2, which is inactive vitamin D, which has to be converted to D3. And a lot of people's bodies do that very effectively. Some people do it not effectively, but they do it. Others don't do it well at all. So you can take vitamin D2, which is the inactive vitamin, and not benefit from it because it's not being activated and turned into D3. So cut out the middleman and take away that question and use a D3 product. The doctor's D is 5,000 international units per day. It amazes me that the FDA still only recommends 800 international units of vitamin D per day. That is ridiculous, and that also doesn't have any substantive or significant benefit for you. You have to take a therapeutic dose. So the first question, or the first decision to make, am I going to take vitamin D or anything else, any supplement or any medication? Am I going to take it, yes or no? You decide to take it. Then the next point of decision is, I need to take a therapeutic dose. So oftentimes people will say, well, Dr. Collier, I'll take that high blood pressure medicine, but I want you to give me the lowest dose. I'm going to take that cholesterol medication, Dr. Collier, but I want you to give me the lowest dose. And that's not I say that's not our golden objective. Our golden objective is to take a dose that's going to give you the benefit that we're seeking, not to take a low dose. The objective is to take a therapeutic dose. So that's what I strive for. So a therapeutic dose of the D3 is 5,000 international units per day. Now, there's combination products with D3 and vitamin K. They are very good combinations, but some people cannot tolerate them. If you have a blood clotting disorder and you take vitamin K, that makes your clotting disorder worse. If you are taking a blood thinner, like clopidogrel or Plavix or Xarelto or one of the others, that some people take if you have cardiovascular disease, if you have had a heart attack or a stroke, and you're on blood thinners, then you cannot take K2 because that will make your blood so thin that you will literally just start bruising all over and oozing blood. So we had a combination product of the D3 and K at one point, but we pulled it back because we didn't want that question to be, or that problem to be out there. You can take the doctor's vitamin D3 formulation. It's compatible with any prescription medication that you're on. It's compatible with any disease state, and it will get your vitamin D level, which should be between 30 and 90, up to between 60 and 90, which is exactly where you want to be to obtain optimal benefit. The benefits of vitamin D3 therapy: 1, strong bones; 2, strong and healthy teeth; strong and healthy skin; strong and healthy hair. That's stage 1. You get that level up to 40 or higher, you optimize the function of your immune system. So you're not as susceptible to viral infections like the flu and the coronavirus, the COVID, bacterial infections like strep throat and pneumonia, and fungal infections like toenail fungus, fingernail fungus, jock itch for men, vaginal yeast for women. Just can't happen when your vitamin D level gets that high, or if it does, it's very mild and muted and self-limiting. Now, you get that level up to a higher level, 60 or higher. There are multiple studies that show that this is a cancer preventive measure, a cancer preventive. So no breast cancer, no colon cancer, no pancreatic cancer, no prostate cancer. All these things, when a person is diagnosed with cancer, the initial therapy that is implemented 100% of the time is vitamin D therapy. And this is not new, but it's relatively new, meaning we knew about the benefits of vitamin D decades ago, but it's become a standard part of the standard of care, as they say. When a person gets a diagnosis of prostate cancer or breast cancer, the first thing the doctor does is put them on vitamin D3 at a therapeutic dose. So that's what we recommend, Winnie. Again, the D3, if you don't have any blood clotting disorders, or if you're not on any blood thinners, the K is a good addition, but it's not going to give you more benefit than taking the doctor's D product at 5,000 international units per day. Thank you, Winnie. We appreciate you. Go to the website. You might get one of those deals. Buy one, get one free. All right, Patrick, what is the best vitamin for someone with eye problems? Okay, there have been multiple eye diagnoses, macular degeneration, etc., that have been found to respond to basic vitamin therapy much better than they do to some of these $1,000 per month eye drops and other treatment options that they're offering now. And some of them are glorified repackaging of the vitamins. They just rename it, but it's still basically vitamin therapy, but they charge you a hell of a lot of money for it. So again, the first vitamin to take for anything is a complete multiple vitamin with iron and minerals. The key phrase in that sentence is complete. A multiple vitamin just is more than one. And oftentimes people will come in with a bag full of vitamins. They got a bottle of vitamin C and a bottle of vitamin D and a bottle of vitamin E. And you can get all of that in one pill. Now, you're not going to get enough of the D because it just, the molecule won't combine. So the tablet will be too big to swallow. So they'll usually have a small amount, maybe 300 international units of vitamin D, and then everything else that you need, including iron and minerals. And so name brands, one a day for men, one a day for women, Centrum, Zbec, but there's no such entity as a generic vitamin. A vitamin is a fixed chemical formula. There's no better way to make it. So if you spend more than 10 or 15 bucks for a bottle of 100, you're paying for a pretty bottle or a celebrity endorsement. So it's important, if you see, a name branded vitamin that is a complete multiple vitamin with iron and minerals, and you see next to it the Publix brand, the Kroger brand, the Target brand that says compare to the package over here, get the less expensive one. It's literally the exact same thing. Now, that is not the case with a lot of generics, because the manufacturing of generics usually requires it to be a similar product, but not the exact same product. Whereas with vitamins, it's different. Vitamins is the exact same product, so there's no modifications, so there's no deterioration in efficacy by getting a generic brand. It's just as good. So a complete multiple vitamin with iron and minerals. Vitamin C has been found to be good, and vitamin B, I think the B12 is actually very good for eye problems as well. So Google vitamin therapy for eye problems, and particularly going to lead you down to macular degeneration, and that's going to be one of the vitamins that's being recommended for you. Great question, Patrick. Okay, one design essentials. I got it. Good evening. How do you go about getting an estrogen hormone test? Not complicated at all. You can get that at virtually any doctor's office. You can get it at urgent care. You can go to a place called Any Lab Test and ask for estrogen and hormone testing. For a woman, I would get at minimum an FSH, follicle stimulating hormone, and a total estrogen. Those two things will answer 90% of the questions that you have about hormone therapy, or do you need it, or whether you're menopausal or not. But there are multiple hormone panels that can check a variety of different hormones that you can get. The problem is if you go to any lab test or someplace like that, you get the results, then what do you do? And so I like for diagnostic testing to be based on a therapeutic option. And so that's why I tell patients I don't order tests that are not going to change how I'm going to treat you. I don't order imaging. If I know what's wrong with your back, I don't need to do a CT scan or an MRI, because diagnosis is easy enough without those tests. And so I don't have to do that, and it's not going to change how I'm going to treat you. So same thing if you get a lab test. You want to get a lab test with a diagnostic purpose, and that's going to result in some treatment or therapy option that you can't consider unless you have those numbers. And so that means you need to have the cooperation of a physician. For a woman in particular, an OBGYN would be your first choice, but you can get that with primary care doctors if they feel comfortable analyzing hormones and treating hormone deficiencies. So that is what I would recommend. I do this in my office all the time because I do bioidentical hormone replacement therapy. And it's important to analyze a woman's hormonal status before you do that so that a customized hormonal replacement therapy can be created that will optimize, that word again, optimize, that will optimize that patient and how they are feeling in their hormone replacement. And really, it makes you 18, 20 years old again because it gives you back the hormone levels that you had at that point. Because as we age, as we get to be in our 20s, men and women, our hormone levels and the manufacturing of those hormones starts to become limited and the levels go down. Now, in some people, they go down slowly. And other people, they nosedive. And so by the time they 40, they got real serious hormone deficiencies. And so in a woman, one of the first telltale signs is signs of what's called the menopausal syndrome. You don't necessarily have to be menopausal, which is defined as not having a menstrual period for over 1 year or 1 year or more. But you can have perimenopausal symptoms, which can still include the hot flashes, the sweats, and all those things, dry vagina, decreased libido, all the problems that you would have. That's one of the reasons that we highly recommend our lipo-HERS. That product will give you the benefit of hormone replacement regardless of what your status is. You don't need to know what the numbers are because all it does is make your body optimize its internal manufacturing capabilities so you can't get too much. It just allows your body to do what it used to do. But it's amazing as to how it makes you shoot your libido through the roof. It makes your vagina thick and moist and receptive. And so your desire for intercourse goes up. Your ability to perform sexually goes up, and the intensity of your sexual response. Your orgasms, if your orgasms are a 5 on a scale of 10, they go to 10 plus. If they're already 10, they go to 20 and screaming your name. So these are, supplements, again, things that can make and enhance your life experience. And one of the things that I highly recommend that every man takes the Lipo T product because it has that benefit. Again, enhances your erectile function, increases your libido, and enhances the amount and the quality of your orgasm, and the same for women. So we had the Lipo T product for quite a few years, and then women started asking, what do you have for us? And I said, you know what? That's a good point. We need to get something for the women as well so that a couple can be optimally sexualized at the same time. It's nothing worse than to have discordance. You got one patient or one person in the relationship that's optimized and operating sexually the way they did 20 years ago, and the other person not. That incompatibility creates a lot of friction in a relationship. But boy, I tell you, when you get both of them going together, wow, enhance the relationship. All of a sudden, that person that you were badly tolerating that because you've been together 20 years is now back to love of your life again, and you're thoroughly enjoying not just your life, but your relationship. And that's what's important. Great question. Okay, what's the best medicine for high blood pressure? Jake, that is a loaded question because there are multiple medications. It depends on a variety of factors, but the most common groups of medications that Dr. Collier recommends, one, are angiotensin receptor blockers that block the response to a hormone that goes to your lungs called angiotensin. Angiotensin 1 goes to your lungs, is activated to angiotensin 2, which makes your blood pressure go up. So there are two ways to block that. There are ACE inhibitors, which block that conversion from angiotensin 1 to angiotensin 2. And then there's angiotensin receptor blockers. So the angiotensin 2, which is the active blood pressure driven, makes your blood pressure go up hormone, can't get to the receptors and cause that response because it's like taking a toothpick and breaking it off in a lock. You can't stick the key in there. When you can't stick the key in there, you can't open the door. So you can't stick the key in there and cause the blood pressure to go up. So angiotensin receptor blockers are primary therapy. They have no substantive or significant side effects because all they do is block the response to that hormone. If that hormone isn't there, they literally do nothing. That's why you can't make your blood pressure drop too low. It can't really do any negative problems. It works wonderfully and has no negative sexual side effects, particularly in male patients. It doesn't take the lead out of your pencil. It doesn't impact your erections negatively at all. So that's always one of the first choices that I make. There are about 15 different medications in that group, different name brands by different manufacturers. Then there's calcium channel blockers. The most popular one, the ones you've heard the most about, is amlodipine, number one most prescribed antihypertensive in the world. It is a vasodilator. A vasodilator, basically, think about the plumbing, the pipes in your home. You have a pipe that's a certain size, and let's look at this one, certain size. What that does, a calcium channel blocker makes the pipe get bigger. So you have a bigger pipe with the same amount of fluid, ergo less pressure. Because again, same amount of fluid of blood inside the blood vessels, the arteries that are now bigger, so less pressure. Now, the great benefit of that is that the mechanism of erection is one of blood flow. Blood flows into the penis. There's a gate that's kind of like the Panama Canal that closes and holds the blood into the penis until a man ejaculates. When the man ejaculates, the gates open, the blood comes out, you lose your erection. That happens 100% of the time. So when people say, oh, I can go all night, not after you have erection, that's what's supposed to happen. Now, you can recycle in as little as 10, 15 minutes in some people, it takes longer. But that is the natural response. You're supposed to lose the erection after orgasm. Now, you have a bigger pipe. That means more blood flow going into the penis. That means longer and harder erections. That is a side effect that nobody ever complains about. Nobody ever says, oh, Dr. Collier, that blood pressure medicine, it lowers my blood pressure, but it made my erections too long or too hard, so I don't want to take it anymore. No, they come in and say, my blood pressure is controlled, Dr. Collier. And guess what? My love life has changed a bit as well. So one of the reasons that those are my first two choices, but though there are multiple reasons that might not be appropriate for a person, or that it requires more than one drug. The average person literally requires 3 medications minimum to control blood pressure. And that is a good thing because you take lower doses of multiple medications. One pill comes from this way and pushes the blood pressure down. The other pill comes from this way and blood pressure down. But the combination of the two presses it down lower. So you get a better response from lower doses of multiple medications, which decreases the chance of having a negative side effect and improves the chance that you will have continuous control. If you take one drug and you keep pumping the dose up, eventually your body will acclimate to that, and it may work quite well today, but tomorrow or 6 months from now, that same dose of the medication might not work to control your blood pressure as well because your body will acclimate. So that's where we are with that. Great question, Jake. Okay, Vicky Joe, I'm having trouble holding lipogels on my tongue for 60 to 90 seconds. What can I do? Oh my goodness, Vicky Joe, I'm not sure about that. Again, I don't know whether you're having to swallow it because your mouth gets full of saliva or what the problem is, but it works under the tongue. It is very important that you try to hold it under there for that long. If you can't, or if you find that you're having to swallow it, remember, it does nothing in your stomach. It is absorbed under the tongue, which is almost exactly like getting an injection of the same medication, which is why we came up with the lipo drops formulation. That may mean you need to repeat the dose. One good thing about it, you can't take too much. There's no downside. So if you can only hold it for 60 seconds and then you have to swallow it or spit it out, just do it again. And that way, that will ensure that you'll get a therapeutic dose of this and any other product while holding sublingually. But again, there's nothing unique about what we're trying to do. You lift your tongue up, you stick it, you squirt it under your tongue, you close your mouth. You just don't swallow. That might be challenging, and I can understand why, because your body wants to swallow. And so you might find if you lean forward a little bit, that will help decrease that. If you sit straight up or even tilt your head back, you're definitely going to get the urge to swallow. But if you try to hold your head back, but I say this casually, but I know 60 seconds is a long time. 2 minutes is a very long time. So I try to occupy myself with other things while I'm doing that. Again, I'll make sure that my mouth is not already full of saliva, because putting something under the tongue will activate your salivary glands and you will start making saliva, and you will see that your mouth is filling up with fluid and you have an overwhelming urge to swallow. So you can, either let a small amount of that out forward, or you can swallow a little of it, but try to keep as much under your tongue as you can for as long as you can. Biggie Joe, that might be the question of the day. Make sure you go to the website, lipodrops.com, and I promise you, you're going to get a good coupon and you're going to get a great deal on more than Lipo Drops. Okay, great question. Earl Thomas, all right. My fiance just got diagnosed with prediabetes and her doctor put her on metformin, but it's giving her an awful feeling. Is there anything else you recommend? Yes, there are other options that you can take. Metformin, however, is it's a drug that comes in two components. One, there's an immediate release formulation, and that is the formulation that usually causes the problem. And that problem is usually GI upset, nausea, vomiting, or diarrhea, or just an underlying sense of dis-ease in your stomach. Now you can keep taking it and probably will get past that, but they have a long-acting formulation called the XR formulation that will work just wonderfully, and it's time release, so it doesn't have that side effect. The other problem is that sometimes doctors will give you too high a dose. The dose that they use in the United States sometimes is 2,000 to 4,000 milligrams with dinner. You take that. That always causes a side effect. I guarantee it will cause a side effect if you take the immediate release or IR formulation. If you take the extended relief, the dosing regimen, in particular if she's only pre-diabetic, 500 milligrams will be fine. 500 milligrams will be all she needs. And I promise you, 500 milligrams of the XR extended release formulation will not have any substantive or significant side effects. You can also take that pretty much anytime you like. What I tell patients, ideally you want to take it before a meal, but you can also, if you can't tolerate it before a meal, you start eating, you take the pill, full glass of water when you take it, not just a sip to get it down, and finish eating. And that virtually will assure that you won't have any GI side effects from it as well. But remember, Dr. Collier's key pearl in reference to taking this or any other medication. The biggest problem that we have, we'll get a glass of water, we get the pill, we take a sip, we put the pill in the mouth, we take a sip, we swallow the pill, we take another sip, then we throw the rest of the water away. What we now have is a wet pill that's in the stomach turning into gum. It sticks to the side of the stomach. Your stomach can't digest it. So your stomach tries to digest it very hard. So it starts kicking out more stomach acid. You get more stomach acid, you start to get the queases, you start to get nauseated. And that pill is going to sit there, and it can sit there for hours. And now, again, you feel like you're allergic to the medication, you're having a bad reaction to the medication. The problem isn't the medication. The problem is the medication taking technique. So what you want to do is take a full glass of water. You take a sip, you take the pill, you take the water, you finish the full glass of water. You don't have to gulp it all down at one point, but take and completely drink a full glass of water, and you will find that will completely dissolve and melt the tablet. That will get it out of your stomach and into your system in as little as 2 minutes. You'll never know that you took that pill. And also, if you have multiple medications to take, even when I'm taking the lipo products, my regimen in the morning is this. I'll wake up, I'll rinse my mouth out, I'll take a pill. I'll brush with a full glass of water. I will brush my teeth, brush my tongue, take another pill with a full glass of water. Now, not only have I started my morning off with 2 full glasses of water, but those pills have been in my stomach. I brushed my teeth for more than 2 minutes. So the first one is melted, the second one is in there. Then I have a process where I shave my face. Okay, that's when I take the other one. So usually it's the lipobiotic that I take, then the lipo cleanse, then the doctor's D. So after I finish shaving, I take the doctor's D. So I got 3 pills in, 3 full glasses of water. So I'm almost at half my full water intake for the day. And I got the 3 pills in, and I never know that, they're on my stomach. They don't bother me in any way. You can do the same thing with your prescription medications. Oftentimes, particularly if you're on medicine for blood pressure, cholesterol, diabetes, all those things, you got a lot of pills to take. So you can stretch them out, create a regimen that works for you to get those pills in singularly if possible. You can take 2 at a time if you like. But the key point and the key component is drinking the full glass of water. That is what makes a difference in how you respond to that. So, Earl, make sure you tell her to get the long-acting XR formulation of metformin, and that should correct that problem. If she still can't tolerate it for whatever reasons, there are other options as well, including the diabetic injections, the Ozempic and the Mounjaro. As a pre-diabetic, she could qualify for those, and insurance will cover it. So instead of having to pay $1,600 to $1,800 per month, she can get it for $20, $25, lose weight in the process, and get that pre-diabetes under control. So that is an option as well. So the metformin is not the only option. It is just the first option and the most commonly prescribed because it's readily available, it's covered by all insurance, and it's very, very inexpensive. But you have to specifically ask for the extended release formulation to get and avoid those side effects. Okay, great question, Earl. Okay, my fur baby. All right. Good evening. My arm was hot and red where they put the flu shot. Am I allergic? No, you're not allergic, but you're having the traditional response to your body's now starting to create an immune response. Part of that immune response is inflammation, and that makes your arm swell and get red and hot. So, again, if you had done what Dr. Collier just suggested, taking the non-sedating antihistamine and the anti-inflammatory, so it's not too late. You can still take an anti-inflammatory, and I would still take an antihistamine because the problem isn't an allergy response. You're not allergic to it, but it is a semi-allergy response. So the antihistamine would work. If you already have the problem, then I would recommend Allegra because Allegra works best for topical skin infections. So Allegra is 180 milligrams. It's over the counter. The generic name is fexofenadine, Fexoidine. You literally can get it from the store where everything's now $1.25. You can get fexofenadine generic for $1.25. You can get some generic Advil, Motrin, Aleve, and get relief from that symptomatology. I would take the medication around the clock for at least 3 days to minimize that discomfort that you're having. And just remember that. So the next time you get an immunization, that you start that the day before you get the shot, you continue it the day of the injection, and you keep for one more day post injection, and you won't have this problem. It just won't happen. Okay, great question, my fur baby. Cherry Woodstock. My daughter's been diagnosed with LPR reflux. The essence of breaking down the teeth enamel and causing halitosis. What can she take cure to use the halitosis? Okay, a couple of things. One, we want to make sure she's on an acid blocker. There are two types of H2 blockers like famotidine and Zantac. Those decrease the production of acid, and then there's proton pump inhibitors like Nexium, Protonix, omeprazole generic. All those are things that she needs to do, but you also need to take care of the acid proper. One of the simple solutions is to eat yogurt that calms the acid down and coats the stomach so the stomach isn't digesting itself because you are predisposed to gastritis, which is inflammation of the stomach, or even gastric ulcers, which will happen over time if she's having that kind of reflux. Now, when the reflux comes up, that's when it's destroying the teeth. If she's young, those that first set of teeth she's going to lose anyway. So the objective is to protect the permanent teeth. If she has the permanent teeth and they're being damaged, then we got a problem. The bad breath, again, will be improved by yogurt. And then you can also take some probiotics, which will help calm the acid down. And then you got to monitor what you're eating when you're eating it. She should not eat anything of substance or significance within 3 hours of lying down to go to bed, because that's when the reflux will worsen. During the daytime, she has more food options, can eat those things that she might like, maybe a tad more spicy, maybe some red sauce food, spaghetti, etc. When you're standing up, walking around, no problem. But if you eat that for dinner, then lie down on it, you're going to suffer all night. It's really going to do some substantive and significant damage to the tooth enamel. So the tooth enamel is a big problem. A lot of people reflux don't think about. They also get the same problem if they are bulimic and they're making themselves regurgitate after eating. Stick their fingers down the throat, the acid eats the teeth up, so you can kind of look at them and tell that something's not right with their dental health. Once the tooth enamel is permanently damaged, it's going to require some cosmetic procedures, bonding, etc., to correct that look, because the tooth will only repair itself minimally. It can only do so much. There are enamel repair toothpaste that you can also get at the store where everything's $1.25. So go get that enamel repairing toothpaste instead of paying $6 for it in Walgreens and Target and other drugstores. You can get it there. It's the exact same product. It's a name brand, and that will help protect the teeth enamel as well. So good luck with that. This is going to be a chronic problem that you're going to have to stay on top of and monitor. But let's start off again with the probiotics and the yogurt on a daily basis. The acid blockers, the H2 blockers, Zantac, famotidine. She may already be on these things. If she is, make sure she's taking them. But the main thing is not to let that acid come from the stomach up the throat to the teeth in the mouth. and that will help prevent it. Because basically, the bad breath we're talking about, it basically smells like vomit, and that's just not a good positive thing to have. But again, negative, a lot of bad damage to the teeth, the enamel, the gums. You get chronic gum disease as well, and it can really be not only disfiguring, but medically challenging, because when you have bacteria entering your bloodstream through your dental structures, it predisposes you to heart attacks and strokes. Okay, great question, Cherry. Letitia J, I'm not trying to lose weight. I have stubborn stomach fat that I need help with getting rid of safely. I'm 45 years old, weigh 150 pounds at 5'6". People think I'm pregnant and I'm not. Okay, Letitia. One, you want to make sure that problem, if it's that dramatic and people think you're pregnant, you want to get checked to make sure you don't have a fibroid tumor, a tumor on the uterus that can give you that appearance of pregnancy. If you've had an evaluation and exam by a GYN, make sure that you share that with them so they'll look for a fibroid, because you don't necessarily have to look for a fibroid when you get a regular pap smear. They're looking down at your cervix and they may not even evaluate your stomach because they think that your stomach is just big. So you want to ask for it. That may require even an ultrasound of the abdomen to rule that out. Fibroids are very common. You're at the perfect age for it, and you're an African-American woman, I think. And so that means you're predisposed to having fibroids. And fibroid can be as small as a grape or a plum. It can be as large as a basketball and give you that look. If it is not a fibroid, it's just stomach fat, guess what we have for you? The Lipo Drops Maximum Strength Formula. Lose the muffin top with Lipo Drops that targets fat in areas that you cannot traditionally exercise it away from, like under the chin, the back of the arms, the bra line, the back fat ladies, the abdominal fat. If you can pinch an inch, you would benefit from the Lipo Drops Maximum Strength formulation. And now that we have the phenomenal, the amazing Lipo Nights that burns fat while you're sleeping, target, guess what? You burn fat from what? Places that you have fat. If you have fat in your belly and your stomach, that's where it's going to burn the fat. So it doesn't necessarily have to result in a substantive or significant weight loss, but just a sculpting and a removal of the fat from the areas that you don't want it. So Letitia, I want you to take that challenge. Get both of those products. Let's see how you do over the next 4 to 6 weeks. And I promise you, you're going to get benefit regardless. But also, I still highly recommend that you have a visit with your GYN to make sure that this is not a problem with fibroids. Because, again, if you are appearing to look pregnant, then that's something we definitely want to rule out. Regardless, though, even if you had a fibroid, you still can limit the amount of fat that's on top of it with those two products. Great question, Letitia. Okay. L. Morton. Okay, I was listening to the radio segment about prostate cancer. What should my husband take as a preventive measure? Omega fish oil, fresh tomatoes, both of the above. There are non-fish oil omega fish oil that you can take. There are also, if a person has no problems with shellfish or fish, period, then the our omega-3 product is incredible because it is ultra centrifuged and purified. A quality omega product should, when you open the bottle, not smell fishy. And if you take one of the capsules and look at it, that capsule should be crystal clear. It should not be cloudy. It should not smell bad. It should not taste bad going down. That is a high quality product. We don't have the market on that, but we do have a high quality product. What we do have a market on is the dosing. To get the benefit from omega-3 fish oil, you need to take 3,000 to 4,000 milligrams per day. Most manufactured over-the-counter capsules are only 1,000 milligrams. That means you got to take 4 of them to get real benefit. That's a lot of capsules because they're usually relatively large and not necessarily difficult to swallow, but large nevertheless. And if you could take in any other medications and you're adding 4 pills of fish oil, then you're going to be challenged on maintaining that regimen. Everybody gets it and starts off okay. But after a while, you get medication fatigue. You say, I got to take 4 of these. Oh, my God. So ours is 1,480 milligrams per capsule. You only have to take 2. 1 in the morning, 1 in the evening. Dr. Collier does it every day, and I highly recommend that. Fresh tomatoes is not necessarily, it's not the tomato proper. It's lycopene that's in the tomatoes that is very good for prostate health. And there are other products that you can get over the market that contain that and other supplements all in one capsule that are good for prostate health as well. So we highly recommend, again, the omega-3 fish oil, the vitamin D, the body's natural anti-inflammatory, because prostate disease, benign prostatic hypertrophy, prostatitis, and prostate cancer. All are inflammatory processes, and vitamin D is the first line therapy. So I'd recommend the Doctor's D, 5,000 international units per day. Omega-3 fish oil, 2 of the lipo omega, 1 in the morning, 1 in the evening. And then tomato-based products, fresh tomatoes are very good, but there are other food products as well. Broccoli and kale are also good supplements to take for prostate health. And again, there's a litany of food recommendations to help with not just prostate cancer, but with any cancer, period, not just prostate cancer. But for prostate health specifically, the tomatoes or one of the tomato-based products are very good. The lycopene in them helps tremendously with that. Great question. Elle, you all right with me? Okay, Rachel Arnold Johnson, I have no sex drive. Rachel, you need the lipo hers that will enhance your sex drive exponentially. You will just, again, you'll be chasing your husband or significant other, your partner around the house, wanting more. Now, I tell people, this is not a Viagra-like product. It's not you take one pill and you lose your mind. No, that's not what happens. There's a process. Every day will be better than the previous day. So you take a pill a day, you'll be better tomorrow. You take a pill tomorrow, you'll be better the third day. But after you've been on the product for at least a couple of weeks, you will start to notice a significant improvement in your libido. After you finish the first bottle, which is a 1 month supply, you will be craving the second and third bottles because you will start to notice really the benefit. And this is not just something you take temporarily. I highly recommend that you take it every day. Dr. Collier takes the Lipo T every day. And believe me, I'm glad that I do. And Mrs. Collier is glad that I do as well, I hope. Sometimes she may not be, I don't know. But I hope that she is. But I tell you, this is a great therapy that we added to our weight loss regimen. This is just general overall health. The Lipo Hers and the Lipo T. The Lipo Hers brought on by the demand of women. What do you have for us? Try the Lipo T product. I'm issuing you that challenge. Come back and let me know how you're doing in 4 to 6 weeks. I promise you, by the end of the second bottle, you'll be a new person from a variety of different perspectives. Healthier skin, healthier hair, but your sex drive will improve tremendously. Your vagina will be thick. Your vagina will be tight. Your vagina will be moist and wet and ready to receive. All of these things because your hormonal status will have been altered by taking that medication. These are not hormones. Okay, that's why they're perfectly compatible with any disease state, any medication that you're on. They don't predispose you to blood clots or anything like that. These are supplements that make your body naturally do the things that it used to do, but that it's no longer doing or it's not doing enough of. So try that product, Rachel, and I promise you, you'll be glad that you did. Loris Williams, are there different types of salt that won't raise your blood pressure? Absolutely, Loris. You're going to get the award for the second best question of the day. Sodium chloride. Sodium chloride. Sodium is a positive ion. Chloride is a negative ion. These are part of your electrolytes in your body. You have 4: sodium, chloride, potassium, and carbon dioxide. But sodium chloride, positive ion, negative ion, they attract each other. This is where the term opposites attract comes from. Sodium combines with chloride to make sodium chloride. Sodium chloride, table salt, the same salt that you get in the blue box with the girl with the raincoat on it, or any other place that you get salt. The problem with excess sodium is that it can increase your blood pressure. Some people it has minimal effect. Other people it has a dramatic effect. It can cause increased blood pressure and fluid retention. So you start to get fat ankles and your feet swell because you have too high a sodium intake. Well, guess what, people? There's a better salt product out there. Sea salt, potassium chloride, which not only doesn't raise your blood pressure, it actually lowers your blood pressure. And potassium chloride is much saltier than sodium chloride. It is extraordinarily salty, so it takes much less to give you the salt taste that you like and crave in your food products. So, and they use that again. I think one of the fast food restaurants, Wendy's, uses sea salt on their fries instead of sodium chloride. They use potassium chloride, sea salt. They advertise it and market and promote it as that. You may not have noticed, but that's why the taste of their fries changed, and they started promoting it as tasting better than the other fries that were out there. So potassium chloride, sea salt, and it's usually on the shelf right next to the sodium chloride, or you may have to ask for it. Again, it usually requires smaller amounts. So if you're cooking with it, be careful about the amount that you add to your cooking product, or it will taste extraordinarily salty. But again, not only doesn't raise your blood pressure, but lowers your blood pressure. So you got two options. You can go on what's called a low sodium diet, or limit your salt, or don't put any, they say don't put any excess salt on your food, because everything that you eat has been salted as naturally. So it comes with a substantial amount of salt or sodium on it. Avoid salty foods like peanuts and potato chips and things that have salt on them. So you want to get the low salt or no salt snacks, or you use potassium chloride, sea salt, which is much better. So, when you put somebody on a no salt, 2-gram, low sodium diet, oh, it's a horrible diet. Food has no taste, and most people just won't stick to it. So they go back to using a regular salt shaker and doing that. Get out of the habit, I would recommend, of automatically grabbing the salt shaker when you get your food. Your meal is delivered, you automatically grab the salt shaker. Now, you can automatically grab the pepper. That's very good. Actually, pepper is a natural anti-inflammatory, helps tremendously. You get the thrill of shaking something on your food, but just don't grab both. People will hand you salt and pepper. Just take the pepper, put that on there. But if you have the potassium chloride, which will lower your blood pressure, it's good for your heart health as well. Lots of cardiovascular benefits from adding additional potassium to your diet. You will find that again, very salty, but very tasty in very, very small amounts. Great question, Loris. Okay. Spanish P, anything for light spots on legs and arms. Light spots can be just that, depigmentation of the skin. It can be something as easy to treat and correct as a fungal infection. Most fungal infections make the skin lighter. There are some that create dark spots, but the vast majority of them create light spots, and people don't even know that it's a fungus. They think it's acid, or this comes from drinking Coca-Cola or eating tomatoes or something like that. It has nothing to do with anything that you're eating. It is strictly a skin fungal infection called tinea corporis, easily treated with topical antifungals like ketoconazole or something like Selsun Blue. Shampoo, you put that on your body, you let it sit on the skin for a couple of minutes, you rinse it off. Now, when your body first starts to kill the fungus, the skin turns whiter, so it's going to appear more dramatic. And you say, oh my God, what did that quack Dr. Collier tell me to do? My skin looks worse. Well, that's just letting you know that the fungal infection is being cured. 2 weeks later, it will turn dark again and blend in, as long as you don't get sun exposure to the skin that's not infected, because it'll never catch up if that's the case. But if you avoid sun exposure, treat the fungal infection, and then allow it to blend back in, 2 weeks later, you will never be able to tell it was there. That is literally one of the most common skin conditions that I deal with. People have fungal infections, particularly on their backs, because they can't see them. Or if you like to go to the gym and work out, but instead of showering and changing clothes, you go home in your sweaty tops. That is the perfect reason that you get these types of infections. Other more dramatic response to vitiligo, that's where the skin is literally depigmented by an autoimmune disease process that can start off in one spot and ultimately cover a variety of your body, particularly your trunk and your extremities, but sometimes affecting the face as well. That is a different type of problem, and that needs to be treated. There are some great treatments for that now that will, unfortunately, most of the treatments require total depigmentation. So you go from being a dark-skinned person to a light-skinned person all over your body. But it blends in, and you don't have that relief map look where you're light and dark, which some people find cosmetically disfiguring. Other people embrace it. There's a model named Winnie Harlow. She has a vitiligo, and she has made that her signature. She is an amazingly attractive woman, but she does have a vitiligo. So that needs to be evaluated and looked upon. But your average primary care doctor can tell you whether it's a fungal infection or not. There's a black light called the Woods lamp that I cut the lights off in the room and shine that on you. If it's a fungus, it lights up like a black light poster. If it's not, but I could usually make that diagnosis without that. But to show it to you and prove to you that I know what I'm talking about, I'll put it under the Woods lamp, and then that will confirm the diagnosis. Okay, Spanish, that was the last question right here. I want to make sure that everybody goes to the website, take advantage of some of our lipo drops, Halloween deals that we got. We got half off. We got buy one, get one free. All kind of bread, and it's various types. You log in, you get it. You're going to get a different one every time. And it's just amazing what's going on here. We want to make sure that you start your weight loss journey now so that as you go through your weight loss, particularly for the holiday season, which is coming up now, you're going to have holiday parties at your job. We're over COVID. Everybody's having big soirees where they have lots of food and lots of drink. You want to make sure that you don't put on 15 pounds over the winter time because of your food intake. Again, we want to monitor what you're eating, but you also can control that by monitoring the way that your body metabolizes those foods and controls those calories. This brings to an end this episode of the Ask Dr. MJ Why? Because your health is important. Facebook Live, Instagram Live, YouTube Live presentation. Next week, next time you see us, we're going to have a special guest. Dr. Sean Garrison, psychologist to the stars. Dr. G is going to be here, and we're going to introduce her to our audience. We're going to have her as a regular part of the program. So tell all your friends now, if you have questions about interpersonal relationships, if you have questions about psychological diagnosis and disorders, anxiety, depression, grief reaction, problems, again, with your marriage and your interpersonal relationship, she's going to answer all those questions. So we're going to talk about your physical health and your mental health. Tune in next time, and we'll see you then. Dr. MJ Collier, we're out.